Hi friends, welcome back to Complete Medical Coding. Today I am here with two important modifiers, Modifier 26 and Modifier TC. The main differences between Modifier 26 and TC. Also we will discuss few important examples, few important type of questions, how we will get questions from these two modifiers, with these two modifiers. Okay. So friends, if you are new to the channel, please subscribe and let's move directly to the video. What is modifier 26? 26 modifier, as you already know, that represents the professional component of a test, including interpretation and written report. So modifier 26 is used for a particular, to report a professional component of a procedure, of a test or of a procedure. Okay, and that includes interpretation as well as report. A written report is also included. What about modifier TC? TC represents technical component. Okay, so modifier TC, technical component, it is used to build only the technical component of a procedure. The technical part, if a technician is doing the procedure, then you have to append it with modifier TC. Whereas if the physician is doing the if the physician itself is doing the procedure, you have to append it with modifier 26. Okay, that's a difference. But still, few people will get confused while coding with these modifiers. So let's move in detail. Some procedures can be divided into a professional component only. That means performed by a physician. It's a professional component only means if the service is performed only by the physician, and a technical component only. Okay, so some procedures are divided into professional component only, some are divided into technical component only. Technical component means technician's portion, means if the technician is doing the procedure, like a radiologist. So modifier 26 is used to describe the portion of the service that is performed by a physician. Okay, physician, whatever the procedure carried out by the physician, you have to append it with modifier 26. And this, if you append it with modifier 26, it means interpretation and report, written report is also being carried out. So let's discuss the difference. The technical component includes what all the technical component includes. If you are appending with modifier TC, it means the technical component includes providing the equipment. If the technician is providing the equipment, okay, or supplies, technical personnel means a technician, cost attendant to the performance of the procedure other than the professional services. Other than the professional services, if there is any other procedure carried out, okay, which involves cost attendance. So all these will be all these will be reported with the modifier TC. And how about the professional component? The professional component includes the physician's work in providing the services. For example, reading films, interpreting diagnostic tests, etc. The physician's part, or if the physician itself is carrying out the procedure, is carrying out a radiology part. Okay, these modifiers occurs mainly in the radiology section. Mainly. Interpretation and written report provided by the physician performing the service. Yes, if the interpretation and report is being carried out by the physician, then you have to append it with the modifier professional component, that is 26. Okay, you will come to know in detail when we will discuss the examples. For those who are new to this coding, you will find it little difficult. For others, it will be easy. If you understand the concept, it will be easy. So 26 modifier, professional component. Certain procedures are a combination of a physician component and a technical component. Okay, certain are a combination. Certain services are a combination of both technical component as well as a physician component. Means professional component. Okay. So when the physician component is reported separately, you have to add 26. Same. Then if the radiologist owns the equipment, interprets the test, and pays the technologist, modifier TC and 26 do not apply. Okay, that is important. If the radiologist is owning the equipment, owns the equipment, and the radiologist itself is doing the test, pays the technologist, then we don't have to append any modifier. Then physician does not own the equipment. If the physician does not own the equipment, okay, then we have to append it with modifier 26. Facility provided the equipment and technician. Yes, if the facility is providing the equipment and technician, you have to append with modifier TC. CPT 76140 only has a professional component, so modifier 26 would not be used. So let's find out what is the CPT code 76140. What is the CPT 7 description of 76140? Let's find out that first. 76140 is consultation on X-ray examination made elsewhere, written report. See here, in the description itself, a written report is mentioned. Okay, if in the description, if there is interpretation and report mentioned, then you should not append with modifier 26. I am telling you about the CPT code, not in the question. If in the CPT code, if then the description says interpretation or interpretation and reading report or interpretation and written report or written report, whatever it is, then you should not append any modifier. Okay, so if you are coding this code 761, this is an example only, not only for this code, such type of codes I am telling. So for the CPT 76140, this type of codes, you should not append any modifier. Okay, hope you understood. So let's discuss few examples. Let's move to the first example. This is a simple example. Still, it will make it easy for you to understand. A patient seeks treatment at the emergency room of a hospital for a head injury. The facility performs a CT scan of the head without contrast. The film is sent by courier to a noted local radiologist office for review. The radiologist reads and interprets the CT film, and seeing no sign of injury or damage, calls the hospital's emergency room or emergency department and advises them to release the patient. So this is the question. This is how the question is. Now you have to code for the facility. What will be the facility bill and what will the radiologist bill? How the facility, it depends on the question. If in the question, if they are asking how the facility report the service, okay, then you have to code only the facility part. If in the question how the radiologist submit a claim or how the radiologist code this service, then accordingly you have to do it. So let's find out the CPT code 70450. This is the CPT code for the CT scan of the head without contrast. 70450. Still, I had already mentioned it here, but still you can open the CPT code book so that you will learn it fast. 70450. What is 70450? Computed tomography head or brain without contrast material. That is a description for CPT code 70450. Okay, computed tomography CT scan head or brain without contrast material. So if in the question how the facility is reporting this claim, how it will report? The facility will submit a claim for providing the technical component of the service with the following claim elements. 70450 with modifier TC. See, place of service will also be included sometimes in some questions, but here in this chapter, in this lesson, I am just discussing about the modifiers. So I am not putting any other diagnosis or I am not explaining any other diagnosis or any place of service here. Just the modifiers, just to understand the modifiers. Okay. So how the facility report? How the facility report this service? Here the equipment is not owned by the facility, right? So you have to append it with modifier TC, technical component TC. Now, how the radiologist submit a claim? The radiologist will submit a claim for the reading and interpretation of the result. That is a professional component, right? The radiologist is the one who is reading and interpreting the report of that diagnostic service with the following claim elements. Same 70450 with modifier 26. Here, the machine is not owned by the radiologist. If in the question, the radiologist owns the machine or owns the service or owns the what do you call it? If the radiologist owns the equipment, then you cannot code with modifier 26. You need to code only 70450. But here in the question, it's not mentioned. So it means you have to report the professional component. Okay. So the radiologist will submit the claim with modifier 26 with the same CPT code 70450. Alright. Now let's discuss another example. Case. This is a case. Okay. What is the case here? Examination, X-ray of lumbar spine. So X-ray of lumbar spine is a procedure carried out here. Indication for procedure, non-traumatic low back pain. Technique, 6 views of the LS spine. LS means lumbosacral, okay. 6 views of the lumbosacral spine and bending views. Findings, 5 non-rib bearing lumbar type vertebrae. There is a disc space narrowing and end plate sclerosis with spurring most pronounced at the L12-3 and L3-L4 level. On the left vertebral body heights are maintained. Spinal alignment is normal. What is the impression? The diagnosis. The impression represents the confirmed diagnosis. Okay. So impression, lumbar spondylosis at L12-3 and L3-L4 levels. So lumbar spondylosis is the diagnosis here. What CPT and ICD-10 codes are reported? So here we have to code both CPT as well as ICD code. The diagnosis you already know, it's a lumbar spondylosis. And what about the CPT code? What procedure is carried out here? 6 views of LS spine. X-ray of LS spine. So let's find out the CPT code first. Anyway, only two CPT codes are mentioned in the options. Okay, if not, you will get options only in the examination, right? So if not for the examination, how you will find the code? You have to go to the index page and find the spondylosis. Okay. So what is 72084? 72084 is radiologic examination, spine, entire thoracic and lumbar, including skull, cervical and sacral spine if performed. Minimum of 6 views. This is spine, thoracic and lumbar. No, we need only lumbar spine. So that CPT code is wrong. What is 72114? 72114 is radiologic examination, spine, lumbosacral, complete, including bending views. Minimum of 6 views. Yes, here minimum is 6 views. Bending views are also present. So radiologic examination, spine, lumbosacral, yes, LS spine of 6 views. So this is the CPT code, exact CPT code, 72114. Okay. So we got the CPT code as 72114. Append it with modifier 26 to report the professional component. Okay. Now diagnosis. What is the diagnosis here? Lumbar spondylosis. So let's find out the lumbar spondylosis code. What is M47.816? Yes, M47. Take the ICD, open the ICD code book. M47.816. It represents spondylosis without myelopathy or radiculopathy, lumbar region. Yes. M47.816. Spondylosis without myelopathy or radiculopathy, lumbar region. If you check M47.817 as in option B and D, 817 means the same lumbar spondylosis, but it represents lumbosacral region. Here we need only lumbar spondylosis as the confirmed diagnosis. Even though lumbosacral spine X-ray is done, but the diagnosis is lumbar spondylosis. So you need to code only for lumbar region. Okay. So M47.816 is the answer. Correct CPT. Sorry, ICD code. What about M54.50 as mentioned in options B and D? M54.50 is the low back pain. Code for low back pain. But that is a symptom. That's not needed. That's not required. As we already got the confirmed diagnosis, or as the confirmed diagnosis is already mentioned in the question. So you don't have to code for the low back ache. Okay. So here the correct answer will be option C, 72114 with modifier 26 and M47.816 for the lumbar spondylosis. Okay. Now let's discuss one more example. A cardiologist performs a 12-lead ECG in his office. He provides an interpretation and report. How does the cardiologist report the ECG? The cardiologist performs a 12-lead ECG and he itself did the interpretation and report. So how does the cardiologist report the ECG? So let's take the ECG code. Is it 93000 or 93010? That we have to find it out first. So go to these two codes, 93000 and 93010. First, let's find out what is 93000. There will be slight change in the description only. Still, you have to find out what it is. So here, what is the CPT code 93000? 93000 is electrocardiogram, routine ECG with at least 12 leads with interpretation and report. Okay, so performing ECG as well as interpretation and report. That is 93000. And what is 93010? Same, electrocardiogram, routine ECG with at least 12 leads, interpretation and report only. So if the cardiologist or if the whoever is performing the service, if the physician performing the service as well as doing interpretation and report, then you have to quote 93000. If the cardiologist or if the physician is not doing the procedure, but he is just doing the interpretation report only, then you have to quote 93010. So here it's clearly mentioned in the question that the cardiologist itself performs the ECG in his office and then he provides interpretation and report. So he performed the service as well as he did interpretation and report. So you have to quote 93000. Since in the description interpretation and report is already mentioned, you don't have to append it with any modifier. Okay, so the correct code will be 93000 with no modifier. So answer will be option A, 93000. Okay, that's how you have to code. Okay, hope you understood these examples. If you have any doubts or clarifications, please mark it in the comments. Okay, so friends, these are few important points from modifiers 26 and TC regarding these two modifiers. The difference, it's very simple modifiers. I'll be back with more and more modifiers. Okay, like each and every modifier, the description or the guidelines, how to code each and every modifier, and in between I'll be coming back with more questions as well, so that it will be easy for those who are preparing for the examination. Okay, so thank you so much, friends, and if you have any queries, please mark it in the comments, and let's see you in the next episode. Thank you. Bye.